What if I told you that some of the medical screenings you've been told are essential for your health may no longer be helping you once you reach a certain age? In fact, some of the most respected medical organizations in America now recommend that certain routine screenings be reduced, reconsidered, or even stopped altogether for many adults over 65. That sounds surprising, doesn't it? After all, most of us have spent our entire lives hearing the same message. Catch it early. More testing means better protection. Screening saves lives. And often that's true. But as we age, something important changes. The balance between benefit and harm begins to shift. A test that may have provided valuable information at age 45 can sometimes create unnecessary risks, anxiety, complications, and even invasive procedures at age 75. Today, we're going to uncover 5 common medical screenings that many physicians think twice about once they reach retirement age themselves. We'll discuss what the latest medical guidelines actually say, why these tests can sometimes cause more harm than good, and most importantly, the 3 questions every adult over 65 should ask before agreeing to any screening. Because the goal isn't to avoid medical care. The goal is to receive the right care. I'm Dr. Thomas, and I specialize in cardiovascular health and healthy aging. Over the years, I've noticed a pattern that repeats itself again and again. A healthy older adult walks into a clinic feeling perfectly fine. A routine screening finds something unexpected. That finding leads to more testing. The additional testing leads to a procedure. And before long, the person who felt healthy is suddenly dealing with complications, medications, stress, and diagnoses that may never have affected their quality of life in the first place. This phenomenon has a name. It's called overdiagnosis, and it's far more common than most people realize. Now let me be clear. This video is not about avoiding doctors. It's not about ignoring symptoms. And it's certainly not about refusing important medical tests. Many screenings save lives every single day. But some screenings have an age where the risks begin to outweigh the benefits. And that's exactly what we're discussing today. As we go through each screening, I'll explain. Who should continue getting tested? Who may want to reconsider? What the official guidelines say? And what questions you should ask your physician before making a decision. Because informed patients make better decisions. Let's begin with number 5. Number 5. Colonoscopy after age 75. For decades, colonoscopy has been one of the most effective tools for preventing colon cancer. There's no debate about that. Finding and removing precancerous polyps has saved countless lives. But here's what many people don't know. For adults over age 75 who have consistently had normal colonoscopy results and who are not considered high risk, major medical guidelines recommend individualized decision-making rather than routine screening. Why? Because the benefits gradually decline while the risks increase. A colonoscopy isn't just a simple test. It involves bowel preparation, sedation, recovery time, and a small but real risk of complications. As we age, those complications become more significant. The risk of bleeding increases. The risk of bowel perforation increases. Recovery becomes more difficult. Even the sedation itself can contribute to confusion, falls, and complications in vulnerable older adults. For many healthy seniors with a long history of normal results, less invasive options such as stool-based screening tests may provide useful information without exposing them to the same procedural risks. The question isn't whether colonoscopy is a good test. The question is whether it's still the best test for your specific situation. And that's a conversation worth having. Ask your doctor. Based on my age, health history, and previous results, is a colonoscopy still necessary? Or is there a safer alternative? That one question could change the entire direction of your care. And what comes next may surprise even more people. Number 4. PSA screening. After age 70. Few tests have generated more debate than the PSA blood test for prostate cancer. The reason is simple. The test can detect prostate cancer, but it can also detect cancers that would never become dangerous during a man's lifetime. Many prostate cancers grow extremely slowly, especially in older adults. In some cases, a man may live another 15 or 20 years without ever experiencing symptoms from the cancer that was found. Yet once the diagnosis is made, the pressure to act often begins. Additional testing, biopsies, surgery, radiation, and with those treatments can come lifelong side effects, including urinary incontinence and sexual dysfunction. That's why many guidelines advise against routine PSA screening for most men over 70 who have no symptoms and no significant risk factors. The key issue isn't simply finding cancer, it's determining whether finding that cancer will actually improve length or quality of life. Before agreeing to PSA screening, ask, if this test comes back elevated, what exactly would happen next? Understanding the entire chain of events before taking the first step is one of the most important decisions you can make, and the next screening affects millions of women every year. Number 3. Routine. Pap smears after age 65. For generations, pap smears have played a crucial role in preventing cervical cancer, but many women are never told that there is often a point when screening can safely stop. For women over 65 who have a long history of normal screening results and no significant risk factors, continued routine screening may provide little additional benefit. Yet many women continue receiving pap smears simply because they've always received them. The problem isn't the test itself. The problem is what can happen afterward. False positives, repeat testing, additional procedures, and weeks or months of unnecessary worry. The purpose of screening is to improve health outcomes, not to create anxiety over findings that ultimately prove harmless. If you're over 65 with a history of normal results, ask your gynecologist, do I still meet the criteria for continued cervical cancer screening? You may be surprised by the answer. And before we move to the final 2 screenings, there's an important concept you need to understand. It's called lead time bias. Sometimes finding a condition earlier doesn't extend life. It simply extends the amount of time a person knows about the condition. That distinction matters more than most people realize. Let's continue. Number 2. Repeated bone density. Testing and osteopenia. Overtreatment bone density testing can be incredibly valuable. In fact, it has helped prevent devastating fractures in countless older adults. But problems sometimes arise after the results come back. Many older adults are told they have osteopenia. Not osteoporosis, osteopenia. And those are not the same thing. Osteopenia represents mild to moderate bone thinning that often occurs naturally with aging. Yet many patients immediately assume they need medication. In reality, treatment decisions should depend on overall fracture risk, not just a single number on a scan. That's why experts often recommend calculating a person's FRAX score, which estimates future fracture risk using multiple factors. For some people, lifestyle changes may be more appropriate than medication. For others, treatment may be warranted. The important point is that the decision should be individualized. Ask your doctor, what is my actual fracture risk, and how does that compare to the risks and benefits of treatment? That conversation provides far more useful information than a scan result alone. And now we come to the screening that often creates the biggest chain reaction of unnecessary testing. Number 1, routine cardiac stress tests and EKGs in healthy seniors' heart disease is serious. No one is arguing otherwise. When symptoms such as chest pain, shortness of breath, dizziness, or palpitations are present, cardiac testing can be life-saving. But testing healthy people without symptoms is a different story. Routine stress testing and screening EKGs in low-risk, symptom-free adults often uncover findings that appear concerning but ultimately have little clinical significance. These findings can trigger additional tests. Those tests can trigger invasive procedures, and those procedures carry real risks. The irony is that the original screening may never have been necessary. Major cardiology organizations generally recommend against routine screening stress tests in healthy adults without symptoms because the potential harms can outweigh the benefits. Before agreeing to a cardiac screening test, ask, what specific concern are we looking for, and how will the results change my treatment? If there isn't a clear answer, it may be worth having a deeper conversation. Final thoughts. The goal of medicine isn't to perform more tests. The goal is to help people live longer, healthier, and better lives. Sometimes that means screening. Sometimes it means treatment. And sometimes it means recognizing when a test is unlikely to provide meaningful benefit. Before your next appointment, write down these 3 questions. 1. Is this screening still recommended for someone my age and health history? 2. What happens if the result comes back abnormal? 3. Is there a less invasive alternative available? Those three questions can completely change the quality of the conversation you have with your doctor. Because the best healthcare decisions aren't made automatically, they're made thoughtfully, they're made collaboratively, and they're made with a clear understanding of both the benefits and the risks. If you found this information valuable, subscribe and join us for our next discussion, where we'll uncover another overlooked health issue affecting millions of adults over 60 and what you can do to protect yourself.